Place fluoride varnish, first open the package. These come in all shapes and sizes, but generally they all come with some sort of application brush and the fluoride itself. Make sure you get any extra varnish off the top because a lot of times it separates, so you'll need to make sure that you have a good and even mixture. When using varnish, make sure that you read the instructions for each brand because some say that you have to dry the teeth and some say that it's not necessary. I'm going to demonstrate how to dry off the teeth if the brand does recommend that. And there are two ways. You could use the air water syringe or the 2x2 gauze. If you keep your fingers somewhere in the mouth, the patient won't close and re-wet everything that you've just dried. Apply a small amount of varnish on your brush and then start near the margin and brush down in 3 strokes. If your patient has a lot of recession or sensitivity, you can also do a little rainbow stripe across the margin like so. Make sure as well that you have a fulcrum so that you have stability to avoid getting the varnish on the patient's lip because the patients don't like the sticky feeling. Also, if you bend the end of the brush at the neck, it will make applying the varnish on the posterior teeth much easier. When billing this code, you want to use Da107, which is topical application of fluoride varnish. Have the patient close slowly, and the patient's saliva will help the varnish harden to the teeth. Also remember to give and document the fluoride post-op instructions to your patient, which are, you can eat and drink right after application. There should be no brushing or flossing for 4 to 6 hours, and also avoid hot, crunchy, or sticky foods for 4 to 6 hours.
The first step is to apply 35% phosphoric acid inside the tooth, starting with the enamel and then the dentin. If you have air bubbles, you want to remove them so that you don't have all the acid in contact with the tooth. Notice that I've applied the etchant beyond my cable surface margin, and you want to do that to make sure that your bonding agent is going to bond to an area that the acid etchant has been in contact to. You want to leave the acid for 15 seconds, and then you want to rinse for 20 seconds. You want to then air dry for 3 seconds and leave the surface slightly moist.
As a permanent luting cement. The thing with zinc phosphate that we have to remember is that it is exothermic, which means that it does release heat. So we want to mix it on a cool glass slab to absorb some of the heat produced. To dispense the powder, fill the cap to the shoulder and dispense onto the glass slab. For the liquid, we want to dispense 6 even drops. If we need more material, we can always double this ratio. So as nearly as possible, we want to form a rectangle with our powder, and then first divide it into quarters, and then one of these quarters is divided into 2/8, and then the 1/8 is divided into 2/16. Each increment is timed as we mix the powder into the liquid. We start with our smallest increment, and we're going to mix that for 15 seconds. Always want to use a broad figure-8 stroke, nice and slow to dissipate the heat, and using quite a large surface area, which will also help dissipate the heat. The second increment is mixed for 15 seconds as well. And now we're incorporating our 8th for 15 seconds. The quarter is then incorporated and mixed in the same technique for 20 seconds. And then next quarter is mixed for another 20 seconds. And finally, the last quarter is incorporated for 35 seconds. Mixed in this manner, our material will be a luting consistency, which will allow for the accurate placement of an inlay or a crown, no matter how precisely fitted the crown or inlay is.
Mixing glass ionomer cement for permanent luting. Read the manufacturer's directions and fluff the powder in the closed bottle. Fill the measuring scoop without packing and level against the plastic lip in the neck of the bottle or with the cement spatula to remove excess. The amount of powder needed is determined by the amount of cement needed for the procedure and by the manufacturer recommendations. Place the powder on the right side of the pad. Replace the cap on the powder bottle. Holding the dropper or liquid bottle perpendicular to the pad, dispense the recommended amount of liquid close to the powder without touching. Replace the cap on the liquid immediately to prevent evaporation. Using the cement spatula, add the powder to the liquid in one portion. Incorporate the powder into the liquid and mix well using a figure-8 motion. Complete the mixing within 60 seconds. Once the mixing is complete, gather all the material into one area. For luting, the mix should be creamy, and as the spatula is lifted off the pad, the cement should follow the spatula for about 1/2 inch before breaking into a thin thread.
I will demonstrate the mixing of zinc oxide eugenol cement to a secondary or sedative restoration consistency. Zinc oxide eugenol is used as a temporary restoration when the pulp is inflamed, as the eugenol has an obtundant effect on the pulp. Fluff the zinc oxide powder to aerate the contents. and place 3 scoops on the pad. Place 1 extra scoop in a corner to be used if needed. Shake the liquid bottle and dispense 4 drops of liquid on the mixing pad. Make sure the powder and the liquid do not touch. To mix, incorporate half of the powder into the liquid and flatten firmly with the spatula. Apply heavy pressure to incorporate the powder. Incorporate some of the second half of the powder. Adding the powder quickly in 2 increments will make for a stronger mix. The cement is the correct consistency when it can be rolled into a ball or roll. Check with your fingers that it is not tacky. Roll cement into a rope with your fingers or the spatula and break into smaller pieces. Each piece will be carried to the cavity preparation. Using a condenser, carry 1 small piece to the cavity preparation. Pack the cement into place with the condenser. If the cement sticks to the condenser, dip the end in the powder. Continue adding increments of cement and condensing until the entire cavity is filled. Smear the cement against the cavo surface margin to create a seal. Using amalgam carvers, create anatomy in the cement.
Hi everyone, welcome to Carrington College. I'm Miss Medina, I'm the dental instructor here, and today we are going to be performing alginate impressions on the maxillary and mandibular arch. So what alginate material is, it is a powder form that looks like this, and most alginate impressions have a scoop for measuring. You can also see alginate impressions that have a type of whiteless powder, but we can also see that there's a scoop in there as well. With each alginate impression material with their scoop comes a measuring cup. Since these are two different materials, they have two different measuring cups. Now, if we were to go and do 2 scoops of alginate here, we would need 2 measurements of water. Now, if we were going to have a patient who has a wider mouth and we need somewhat like a large tray, we're going to want to use 2 or 3 scoops of alginate. If we have a child or maybe someone with a very small mouth who needs a small tray, we can use 1 scoop of alginate. The temperature of water makes a very big difference when you're mixing alginate impressions. The water, if it is hot, like it affects, temperature affects a lot of things in dentistry. If the water is hot and we start mixing this alginate, the alginate impression material is going to set faster, okay? Which means that we have to speed it up. So every time you mix an alginate impression, you want it to be cold water. So now that we have our mixing bowl, we have our alginate impressions, and we have our cup filled with our cool water, we are going to get the measurements ready for our alginate impression. Now, this little guy right here is a mixing spatula. Mixing spatulas can be plastic. They can even be metal. And this particular guy is plastic and it smells like orange for the sake of the patient. So what we're going to do is when we measure our alginate, we want to be sure that we scoop the alginate and we go ahead and we pack it down with our spatula like so, okay? And we kind of even out the scoop. Because if we're measuring 2 scoops of water and we have a heaping scoop, then the alginate is going to set faster because there's not enough water. Then you take your scoop and you tap the top of the scoop to get the impression material into the bowl. Again, scoop, pack, and measure. And then, so the next thing we are going to do is we're going to mix this and set the tray. Now, when you do alginate impressions, like everything in dentistry, you want to be fast and efficient because we have our patient in the chair waiting, we have a schedule. And so this particular alginate impression, there is a fast set, which is this one, and there is a regular set, which is this one. Now, when the time you put the water in to the time it sets, you have anywhere between 2 to 3 minutes. And so once you place this water in the alginate, you have to mix pretty quickly before it starts to set. Now there's a 30-second mixing time, and then there's about a 1-minute time to load the tray, and then an additional 1 to 2 minutes to set in the patient's mouth. What we're going to do is we are going to go ahead and start with our water and pour it in our mixing bowl. So we go ahead and pour like so. All right. The first thing you want to do is you want to mix the alginate impression material with the water. Because if you start mixing like crazy, all the powder is going to pop out everywhere. So you want to go ahead and get everything wet. So now you guys can see all that clumpiness inside, right? Okay. So the next thing you want to do is you want to press this material against the side of the bowl so all the bubbles and all the material can mix together. And again, this is a skill that we will be able to practice. Now, if you guys notice, the powder turned pink, then it turned purple, and now it's turning light pink again. So this particular powder starts to turn white when it's setting, okay? So as you can see how the consistency now is a lot more smoother, okay? So again, I'm going and using the side of my bowl and turning to push down and mix this material. And again, these are why the bowls are the rubber the way that they are. So we're going and we're mixing here. Once you feel like the mix is mixed all the way, there's no clumps, there's no dry powder, you can then scoop it into the alginate tray. So what you want to do is you want to take a huge scoop of alginate material, take your tray, and you want to go ahead and use the side of the tray to help push the material in the tray, and then use the spatula to help spread it around. You want to go ahead and grab the next amount of alginate impression material and do it on the opposite side. All right, so once you have the material placed into the tray, Sometimes it's good to use your finger to help smooth out, because if it's all clumpy in here, when you take your impression, it's going to distort the impression. So when you guys are placing the alginate impression inside the tray, it is very important that you guys have this nice consistency. I don't want a bunch of clumpiness, a bunch of dryness, and you can kind of see the difference of the two. How this one is really, really smooth, and this one's kind of clumpy and dry. So if you can think about it, if we don't have a smooth consistency and we go ahead and we place this in our patient's mouth, it's not going to correctly capture all the anatomy and the shape of the patient's tooth.
Welcome. Today we're going to be doing a demonstration of alginate mixing, hand spatulation. This will correspond with the UCDH Dental Materials Lab alginate demonstration number 1. I have set up here for me a couple of different options of what you'll encounter when you're mixing up your alginate impressions. The first one is an example of a wet mix. The next one will be an example of a dry mix. We have a warm water, improper mix, and then we'll finish up the presentation with a correct mix. Now the first thing that we need to start off is we need to make sure that we have the proper measuring when it comes to the alginate. So what you want to do is you want to tumble the alginate. We're using a beaver tail spatula to hand spatulate. You can use any spatula, but what you want to do is you don't want to do an uneven or an unmeasured scoop. You want to make sure that you tap a little bit on the handle. You can even tap a little bit through the alginate itself, and then level it off and place it in your bowl. Now this particular alginate calls for equal measurements of both alginate and water. And so in the wet mix we have a little bit more water. I'll demonstrate what happens in the wet mix. The initial wetting process goes very, very quickly. All the dry spots in the alginate you'll see disappear, but the alginate is left with a very shiny sheen and kind of a chunky look to it. What happens is as you mix, you'll notice that the alginate seems like it's the proper consistency, but it starts to droop and drip because it's too runny. And you don't want to place this in your patient's mouth, because if you're doing an upper impression, it will start to fall towards the back of their mouth or the back of their throat and can become very uncomfortable. That is a demonstration of a wet mix on the alginate. Okay, let's move on to the dry. The dry mix, however, is the opposite from the wet in that it takes quite a long time for it to look like the material is being thoroughly wet. And so as you continue to stir any of the moisture into the mix, you will see that it has a very powdery look to it and a very chunky look to it, and it will not go smooth at all. Dry spots are often left at the bottom of the bowl, as you can see there, and it's very crumbly when you pick the alginate up. A warm water mix, however, can be deceptive in that when you're mixing it, it will appear to mix just like a regular or properly measured alginate mix. It appears very smooth, very creamy, and can be scooped up onto your spatula very nicely without drooping off. The problem with a warm water mix is by about the time you get to where you're picking it up on your spatula to place it in the tray or to load it in the tray, it's already set. Improper mixing, I often see students or people who are initially getting used to the idea of mixing alginate. They will thoroughly wet the material, and they'll either just to continue to stir like so, thinking that the material will get a homogeneous mix, or they will take the spatula and pat it, or do some sort of a suction motion like this, expecting it to work. And as time goes on, the alginate starts to set and the mix is not properly done. When we get to the correct example, we have filled the water measurement up to 3 measures of water with only 2 scoops of alginate. The reason we've done that is we are going to pour out to the first measurement so that we have some water left over that we can dip our finger in to put a moisture barrier on the impression. So we will fill up to the 3rd line, pour out to the 1st, as we spatulate the material, we spatulate it into one spot, making sure they pick the material up. Thoroughly spatulate it. When we're done and we're ready to put it into the tray, make sure that you load it in at an angle from both sides. Once you've done that, you can then dip your finger in water, come up and put a nice, smooth, glossy moisture barrier on the impression. And that is the proper way to mix. Alright, we have 2 different impressions here of the exact same lower mandibular arch that I'm going to do a contrasting comparison with one impression where the alginate was too runny and another one where it was the perfect consistency. First of all, let's view the very front of the tray. You can see here on this one where the material was too runny, you can actually see some of the actual holes, the retention holes, that are still visible. The material, the alginate, was actually pushed out of the way by the mouth muscles because the alginate was too runny. You can see a hole here, here, and here, and you can see that the tray is still showing through. I'll highlight it here with this pencil. On this impression, you can see that there is a small portion of the tray that's showing through, but the majority of it is covered up, and you can see there's a large rounded type of border as opposed to this sharp contrasting border right here. Let's hold this up and show you. You see how thin this is? This is thin because the alginate was thin and the muscles were pushing the material out of the way. I can move that with the end of the pencil there. You can see how thin it is, as opposed to this, to where it is larger, thicker, and more rounded. It's not just, it doesn't come to a point. If we also observe on the very back in the retromolar pad area or the back of the mouth, you can see these here are very thin, very flimsy, because again the material was wet and the muscles were pushing the material out of the way. Whereas on this, they are thicker, they hold their shape, and there's a much more rounded vestibule all the way through the mucobuccal fold, as well as on the inside, on the lingual. So in comparing and contrasting both of them, you can see the difference. You can also see how the tray back here on this one is actually showing through. And you can see the borders of the stock tray, whereas with this one, it's not as visible and it's a little more defined on the borders. Let's flip it over and see what the difference is between a runny and a perfect consistency. On the runny side, you'll be able to see that not all the material, even though the tray was seated, not all the material made its way or was pushed up through the retention holes. Here on the very back portion, you can actually see it's almost a concave type of hole right here, as opposed to the holes that are here where most all of the material is pushing through, just like those typical Play-Doh models that you use where you put the Play-Doh in, squish down, and the hair comes out. You can see how much more defined these ones are than these, and how they're coming through almost all of the holes, as opposed to the runny model where it's only coming through the front. And so please make sure that when you do seat the material, that if you're not getting all of the material to push through those retention holes, then you probably have a mix that's too runny. Looking on the sides, you can see how well defined those borders are and how it's coming up and over and around the tray. The lip line is right here, whereas on this one, comparing both side to side, you can see the material is kind of flimsy and just all over the place. There's no really well-defined borders here as opposed to here. And last of all is the ability of, if you have a wet mix, that the material pulls away. Can you see how I can put a little bit of pressure on this and pull that front section right next to that labial freedom away with just a little bit of pressure because the material was running. Same thing back here on the flanges of the tray. Just a little bit of pressure pulls that away, which is cause for distortion, whereas here I can apply a lot of pressure and nothing pulls away. Same thing with here. Because the material has gone around the borders of the tray and is stiff and holding to itself, you don't get that flimsy reaction like you do here as opposed to here. Okay? So those are comparing one that was flimsy and one that was
Alright, so now we're going to do our alginate impression on our patient. This is going to be an alginate impression demoing the maxillary arch. So we're going to do type of simulation, and we have Heaven, our student, volunteering today. The first thing you want to do is you want to put a patient bib on them. We are doing an alginate impression in the mouth. Sometimes patients may drool, and sometimes patients will have a gag reflex. So we want to be sure that if anything happens, they're protected. So we are going to go ahead and place our PPE on, our mask, and our gloves. When taking an impression, what we want to do most importantly is we want to adjust our patient to the height of us. We want to go ahead and lift the patient up in the chair. When I'm placing an impression in my patient's mouth, we should be comfortably like this, kind of where our forearms are parallel to the floor. So I'm going to go ahead and have Heaven open up. Okay. So the first thing I'm going to do is I think she may be a medium. So I'm going to go ahead and grab my medium tray and I'm going to place it in the patient's mouth. So when we place it in the patient's mouth, what we're looking for is comfort. Is it going to pinch their cheeks, pinch their gums, rub against their teeth? Does it even fit in the arch to be able to capture the whole entire mouth? Please open. I'm going to use my finger to retract her cheek, and I'm going to swoop in the tray like so. Open big. And then I'm going to lift her lip and try this tray on. Now, open please. I feel that this tray can't go all the way inside her mouth because of the fact that her arch is too big. So if here's our tray, the patient's arch is kind of like this and the tray's not going down all the way. So that lets me know that I need to go ahead and try on a different tray. So I'm going to go ahead and go with my large. So again, we're going to do the same thing. Open big, retract the cheek with my finger, and go ahead and swoop in the tray. Stay open for me, don't bite, and then I'm going to retract the lip and press the tray down. So then now we have the impression tray ready for our patient. So now that we located the type of tray that we're doing, we are going to start mixing and then place the tray. For demonstration purposes, we had pulled the cart up closer to the patient so you guys will be able to see me mixing and going through the procedure. Usually in an office, everything is done behind the patient. So the patient doesn't see the trying of the trays, doesn't see the whole setup here. Okay, Heaven, thank you for coming into the office today. The doctor requested we take some alginate impressions. So you take your scoops of alginate, use your spatula, and today we are going to use 3 scoops. Because I'm using a large tray on our patient. Again, measure the scoops, pat them down, compress them with the spatula, even them out, and then place them in the bowl. Every operatory has water, so you should be able to fill up your measuring cup with water. We use 3 scoops, so I want to go ahead and use 3 scoops of water. Place the water into the material, and you go ahead and mix. When mixing, you want to make sure all the material is wet before you start using the sides of the bowl to press out all the air bubbles. Again, now that everything is mixed, we are going and making this material a smooth consistency. Okay, we'll take 1 scoop, use the side of the tray, place it in. Again, you can use your finger or the spatula to help make sure that alginate impression material is smooth in the tray. Okay, go ahead and open. Retract with the finger, hold your tray like so. All right. Line up the midlines, retract the lip. At this particular point in time, it should take anywhere from 1 to 2 minutes for this alginate impression material to set. And so see my position, this hand over here has alginate material, so it's away from the patient's head, and I'm using my forearm for support. So it feels like the material has dried, has set. So I'm going to go ahead, place that air bubble, rock back and forth, and then we have our impression like so. So now we're going to move on to the lower jaw, which is our mandible impression. The goal of trying in the tray is you want to make sure that the tray seats all the way down and you have a little bit of wiggle room so it's not tight against the teeth where you can miss that on the impression. And so again, open please. We retract, slide in, bring our tray, retract the lip, line up the midlines, and press the tray down. Then we are going to go ahead and support the jaw with our hand like so. Okay? Now we will have alginate material on our fingertips, but not necessarily on our palm. And we can use our thumb to press the material and see if it is set. So now our alginate material has set, and now we want to remove the tray. I'm going to go ahead and switch fingers and hold this tray with my hand. I'm right-handed. You probably want to use the hand that you're most dominant with, right-handed, left-handed. And so I go ahead and switch positions. I hold the tray like this, take my index finger, go into the mouth, under that vestibule, and at the same time, make an air bubble, and then wiggle that tray up and then outside the mouth. So now we are going to try the impression with the material inside the tray for placement and removal. We have our smooth consistency like so. All right, Evan, please open for me. Retract the cheek, swoop in the impression material, retract the lip, find the midline, place the tray, support the jaw. I can use my thumb on the side here to just check that impression material to see if it's set. This particular material sets pretty fast, so we're going to go ahead and remove it. I'm right-handed. I'm going to grab the tray like so, index finger, round the vestibule, find that air bubble, rock, and remove like so, and we have our impression. After impressions are done, patients usually get really messy from the alginate. And so what you would do, and recommended, is to go ahead and change your gloves and grab a fresh pair of gloves. And on our tray, we have a piece of gauze. You can wet the gauze, and you can go ahead and give your patient a courtesy clean. Sometimes you don't have to do this, and you can just escort your patient to the bathroom.
The capital is the upper portion of the maxillary cast. The base is the lower portion, the part that's resting flat on the table. The art portion is the non-anatomical portion of both the upper and lower casts. The heel is the portion between the side and the back of each cast. The side area is the flattened area on the side of each cast, and the arc is the circular area on the lower cast. Before we begin, I'd like to show you a set of properly trimmed models so that you can see what we're trying to achieve. The capital and base are parallel to the floor. The total height is 2 1/4 to 2 3/4 inches. When in occlusion, the backs of the upper and lower casts are in the same plane. The art portion of each cast is symmetrical, thus reflecting any asymmetry in the occlusion. The periphery of each cast is approximately equidistant from the facial surfaces of the teeth, and it is trimmed to the depth of the vestibule. All vertical line angles are parallel and perpendicular to the base. The heels are from 3/8 to 5/8 of an inch wide. They are equal from right to left, but not necessarily equal from upper to lower cast.
The alginate impression is a negative replica of the patient's dentition. The impression must be poured up with a durable product to create a positive replica. We use dental stone or plaster to make a model that can be used for study models or lab work. I will demonstrate mixing dental stone and pouring a maxillary and mandibular impression without a stone base. These models can then be used to make bleaching trays or athletic mouthguards. The correct ratio of dental stone to powder is 100 grams of stone to 30 to 34 milliliters of water. 34 milliliters of water is added to a rubber bowl. 100 grams of the powder is added until the particles become wet. Gently stir all the powder into the water to minimize the amount of air trapped in the mix. Vigorously mix by wiping the spatula against the sides of the bowl to incorporate all the powder and remove excess air. This is called stropping. Mixture should be smooth and homogeneous. Turn the vibrator on low and place the bowl on the work surface. Covering the vibrator with a plastic bag will make for easier cleanup. Press the bowl downwards onto the vibrator and press the sides of the bowl inward with your hands. This will remove all air incorporated during the mixing procedure. Holding the handle of the impression tray, place the tray onto the surface of the vibrator. Angle the tray with one posterior edge touching the vibrator. Pick up a pea-sized increment of stone on the end of a small spatula. Allow the stone to flow into the tooth indentations. Tilt the impression as needed to aid the speed of the flow. Continue adding small increments of stone to the most posterior end of the tray, allowing it to flow anteriorly. Air bubbles will form if the mixture flows too quickly over the tooth indentations. Tilt the impression toward the opposite posterior end and continue adding stone until the flow reaches the other end of the impression. When all the tooth indentations are filled with stone, lift off the vibrator and begin adding larger amounts of stone until the impression is filled to the top. Vibrate the entire tray for 2 to 3 seconds to settle the material. Place the impression on a tile with the tray edge towards the tile. Stone must set for 45 minutes before unmolding. After the stone cools, it begins to absorb water from the alginate and the final strength of the stone will be compromised. Stone that has been left in the alginate too long will have a chalky surface and be prone to breakage. Remove stone model after cool to the touch, at least 45 minutes after pouring. Before removing stone from the alginate, take a lab knife and clean excess stone from tray. Unmold impression carefully to avoid breakage. Inspect incisal and occlusal edges for voids and excess blebs of stone. Air bubbles incorporated into the stone during pouring will result in voids in the final stone model. Remove blebs of stone with the lab knife.
Start with an adequately poured cast that is sharp and smooth and thick enough for total height. Small bubbles can be removed with a No. 7 spatula prior to trimming. If you soak the casts in water for 5 to 15 minutes, they will be easier to trim. However, make sure that you don't place them under running water or soak them for a prolonged period of time. This will cause a great deal of surface roughness. Now we'll move to the model trimmer, and I'll show you how to actually trim your models. Before you begin any trimming, make sure that the table of your model trimmer is perpendicular to your cutting blade. When trimming, you should begin with the upper cast. You may have to trim down the sides a little bit so that it can fit inside the model trimmer. The first cut that you make on your cast is the most important one. And this is the cut where you trim the capital. You should trim it so that the plane is from 0 to 5 degrees to the occlusal plane. This is to compensate for the curve of speed. After your capital is trimmed, you should establish the midline. You can mark it with a pencil and follow right along the midline suture. Don't use the space between the two centrals as a reference point for your midline, because this very often may be off-center. Now you will trim the back of your cast so that it is perpendicular to your midline. If you keep the capital flat on the table of the model trimmer, the back will be 90 degrees to your capital. Make sure in doing this step that you don't trim in too far. When the back is trimmed, you can then trim the side. I prepared a cast here to show you what we're aiming for in the sides. You want your cut to be parallel to an imaginary line drawn from the cuspid through the central fosses of your posterior teeth. The opposite side should be even with your initial cut. You use an angle former to check these measurements. It will make it a lot easier for you to get these areas even. If you don't have an angle former, you can get the sides even by transferring the midline onto the surface of your capital. Draw two parallel lines perpendicular to your midline. Measure equal distances along the parallel lines to the opposite side, and draw a line through these distances. Now you can cut away your capital until it is even with this line. With a little more experience, you can cut these sides by just using eye judgment. After your sides are trimmed, you'll trim the front portion of the model. You should trim from an imaginary line opposite the center of your cuspid to the midline on the most normal side of the cast. After you have your fronts trimmed, you may trim the heels. The heel should be perpendicular to a line drawn bisecting the angle opposite the heel. A good way to get these heels centered is to place your thumbs right on the angle opposite your cuspid. Now we've started trimming the upper. It's symmetrical with all angles equal, and the back is perpendicular to your capital surface. To trim the lower cast, you should relate the upper and lower cast together. A wax bite is very helpful in doing this. The first cut on the mandibular cast is to make it the back surface parallel and on the same plane to the back surface of the maxillary cast. The easiest way to do this is place the capital flat on the table of your model trimmer. Place the teeth in occlusion and trim until the backs are even. You can check this by setting your models in occlusion on their backs. After you have the backs trimmed evenly, you should trim the base of your model. Set the back of the mandibular cast flat on the table of the model trimmer. And trim the base. Make sure that you keep the back of the model flat on the table, and this will ensure that your cut on the base will be perpendicular to the back. The next step is to trim the sides. You will do this in the same manner as you trim the sides of the maxillary cast. You'll notice that I've trimmed down a little bit the sides of the cast so that it would fit in the model trimmer. I have a pre-trimmed cast here to show you how the completed trim of the sides should look. After the sides are trimmed, you should trim the arc. The arc should be a concentric circle, a semicircle concentric to a circle that would be drawn through the facial surfaces of your anterior teeth. After the arc is trimmed, you should trim the heels. Unlike the maxillary cast, the mandibular heels should be trimmed so that they are parallel to the opposite side. When the mandibular cast is trimmed down, you should relate it to the maxillary cast. Resting the cast on the back. If the backs are not perfectly equal, you may have to trim a little bit more to even them up. Now that our models are all trimmed, I'd like to say a few words about finishing the models. While they're still wet, fill in any voids with a mixture of plaster about the thickness of heavy cream. When the plaster is fully set, smooth all the flat surfaces using a large Arkansas stone or sandpaper. And using the sandpaper, make sure that you place it flat on the table and rub the flat surfaces of your model along the sandpaper. This will help ensure that you keep your angles sharp. You can use a number 7 spatula to remove any imperfections as bubbles along the gingival borders. The tongue space should be cleaned out using a rotating stone or a lab knife. Allow your models to dry for 1 to 2 days, and then label the models with a sharp pencil. You should print in capital letters 1/8 of an inch tall. On the first line, put your patient's name, and on the second line, the age in years and months, and the date that the impressions were taken. On the lower model, just put the patient's name.